Oh my gosh, some of these hospital rules for labor are crazy. We're going to talk about hospital rules in labor, which are actually rules, and do you have a choice in the matter? Hey guys, I am so glad you're here. First, I am Mandy Irby. I am the birth nurse, and I am live in my group tonight without any warning. So sorry about that. I am a labor and delivery nurse. I've helped thousands of families give birth in labor and through labor, and I've helped hundreds of families prepare to birth boldly. I help busy people birth boldly. Tell me in the comments what you think is the craziest rule you have ever heard, or if you've never heard any rules in the hospital, I don't believe you. Maybe is there a rule that you wish a hospital had, like limiting visitors or something like that, so you didn't have to be the bad guy? Let us know in the comments so we can talk about if that's a real rule or if that's something you should put on your birth plan. Let's get the story straight in the comments. This is kind of a rant because I'm really hyped up, and that's why there was less warning for this video. I had to go live because I know y'all want to talk about this. I know, because I have like a fiery passion about this. And of course, even with my rants at the end, we are going to talk about your choice. I love choice. I love autonomy. I love teaching people what your power is, right? And what is your choice. So we are going to get to it. But first, I just found out. Now, I didn't just find out, but I found out again that there's a hospital, one specific hospital, I don't know where it is. Okay, the rule I heard today was that patients, so birthing people, are not allowed to get out of bed in labor. What? Hey guys in the chat, thanks so much. Keep them coming. Keep your questions and comments coming. I want to talk about them. What the heck? People are not allowed out of bed in labor? So this is coming from a labor and delivery nurse. I'm not going to say who it was. I'm not going to say, I don't even know where it was. And I don't know this person. But I was like, that sounds like torture. And she said, yeah, I know. But then she said, not very many people ask to get out of bed. So this almost was a rant about the language of labor and the language of pregnancy, which leads to the language of feminism and women and bodies and patriarchy. So we're not going to get into that today. But most people don't ask to get out of bed. So we need to talk about rules. Is that a rule? Yes, that's a rule that I've heard in hospitals. And there are different types of rules. And we're going to talk about two different types of rules tonight. So that is one kind of rule. And the other kind of rule, and you think, so when I was thinking about this, like, aren't there rules for safety? Like maybe you can't get out of bed because it's not safe. Still, I feel like that's torturing someone. But even if you go with the safety rules, there are rules like hospital rules, like facility rules that dictate. So if you don't even follow, if you don't follow a rule, what would your consequence be for not getting out of labor or not getting out of bed in labor, right? Do you have a consequence? And I asked what would be the punishment? And she said, there's no punishment. So then you have to think, well, what would be a rule that would have a punishment? Silly word, consequence. What would be a rule that has a consequence? Well, everything in labor has a consequence, right? Everything. That's what I'm teaching my 4-year-old right now. And it's just looking at it through a different lens. Everything has a consequence. So, okay, a rule with a consequence. Hospitals are not allowed to administer a lethal dose of a medication in order to help someone commit suicide. Now, I know that's not true in every state, but that's true in my state. And yes, there's definitely a consequence to that for both parties. The patient will not be alive anymore, and the provider or the nurse or the hospital person will have broken the hospital rules and the policy in the hospital. Though that's a rule that's in place for safety, right? But that's a little bit easier to identify. also could be a patient's choice. So the patient would say, the choice would be, I want you to administer, I'm going to decide. So I'll be the patient. I'm going to decide that you're going to administer potassium to me in my IV to help me commit suicide or to hurt me. Well, actually, ethically and legally, your provider in a lot of states, in my state, can't, well, in every state, every provider can't do something to knowingly hurt you. And in states where provider-assisted suicide is legal, then they've decided that it's not hurting someone, it is allowing the ending of suffering. So that's totally different, but they can't do anything to actually hurt you. So the consequence to the patient would be like, yes, you can make that decision and ask for that and choose that for your health. But instead of actually getting that done, you're probably going to get a sitter to be with you because you're suicidal. You're going to have some follow-up recommendations for like psychiatry and things like that. And you're not going to have that event happen in the hospital because probably in that specific location, that is against what they do to provide safe care for people. Okay, so it's going to make more sense. That is one type of rule. And then the other type of rule is a rule on your body. So a rule that affects a hospital facility, that is the number of people in the operating room for your cesarean. Have you ever heard of that? Like a limit on that, or minimum or maximum? Usually it's a limit on the number of people that can be with you in the operating room. I've heard that one person can be with you, like your partner or your photographer or your doula or your mother. And I've heard that no one can be with you. That is something that you may not enjoy as a facility rule, but that is a rule in a facility that they are going to follow and can have you follow because they believe that that is how they can provide the safest care for you. And so they could ban people from being in the room. So that is kind of their, that's how they can, I forget the word. Annie, what's the word? That's how they can enforce that rule, is that they can actually ban anyone else from being in the operating room in order for you to have a safe cesarean birth. So that would suck. That would be a consequence. But it's also the facility rules, and the difference is the facility rules are things that you can potentially find out. You're not going to be able to ask every single rule because you're not going to know what to ask. But potentially, these are things that help you choose which facility you give birth at. Okay? And then rules on your body. Not being allowed to get up and walk around. Have you ever heard that rule? Excuse me, you have to wear our gown to give birth. So I was just looking at recently when I heard this getting up and walking around BS, I was like, what the heck is this? Like that is not a thing. Why are people telling people that's a thing? I looked up some sites, and Kaiser actually does a good job on one of their sites. They have a great marketing team and things like that. Kaiser wrote on their site that they recommend getting up, getting out of bed. They actually had pictures, like graphics of pregnant people and partners in different positions, and they recommended them to be useful for pain control, comfort, and the progress of labor. I thought it was awesome. So if it's a Kaiser facility that says that you're not allowed to get up, that might be a culture in that one Kaiser facility, but that's not what Kaiser believes as a whole. So then the question would be, what would be the consequence if I were to walk around in labor? And then they tell you, well, we would want to do this or we would want to do that. And then that's more and more decisions. So you see why we work so hard. If you're in the Birth Nurse Academy, you have heard me talk about practicing communication. We work a lot on communication and the brain technique to discuss and make choices, listening to your gut, listening to the pros and cons, listening to the consequences, listening to the benefits and the risks, discussing and practicing making choices, because there are a lot of freaking choices to make sometimes, especially when you're confronted with something like this. So if this were to happen where I was giving birth, I would be like, what? I'm just going to get up and we're going to talk about what my options really are if I were to do this. And they may say, well, we would want to monitor you, or we would, I don't know what the consequences would be. We're going to be upset with you, but still, that shouldn't affect how they treat you in labor. That's an ethical care of a provider. And hopefully would not have to escalate. They would just be like, okay, well, we don't really recommend it. Maybe your nurse would have to stay with you and make sure that you're walking around safely, which would be awesome to have an additional support person at your side, I think. You can't, one of them, okay, I've heard this. You can't bring your own tub to the hospital. Now, what kind of choice or rule, what kind of rule would this be? Because that seems like totally unfair. It's a facility rule. It's a rule about the facility. So if you chose another facility, they could potentially allow that, be okay with it, look into it, measure, things like that. Or at some facilities, I've heard that there's like a structural problem. So the integrity of like the weight of the water, the integrity of their building, there are limitations to like risk and safety of other people. So they have to weigh that and make a rule for their facility. So then that would go into something you would want to ask ahead of time and discuss with other facilities for planning where you're going to give birth. Does that make sense? So sometimes there are rules and they're totally acceptable. Like I wouldn't want someone I wouldn't want 10 people above me. So in our hospital, we have the labor, and then you go downstairs to the recovery area, like mother baby. And I wouldn't want to be in mother baby and have 10 people breaking the structural integrity rule and having full tubs up above me. Like that would be risky for my health, right? So we want we want to follow facility rules for safety and well-being of other people as well. But it's hard to know what is a rule for the facility and what is a rule for your body. Another one, you are required to have a Foley catheter during labor. I have heard that. That is common. Have you ever heard that rule? How do you feel about it? What's your first gut instinct? What are the feels that happen right there? Or freeze your face. Or ugh. Or what the heck is that? That's how you feel about it. So check yourself. And then we have to decide, is it a body rule or is it a facility rule? These are tricky. These are tricky. So then you could ask, if it's in the moment, you could ask, okay, I don't want that, or I don't think I want that, or my face is telling me I need more information, right? If you're like, oh, is it only when I get an epidural? I need more information. Is it only when I'm in active labor? Is it only until I'm pushing? Is it what happens when I'm pushing? What are the risks? What are the benefits? What are the risks for infection? What are the benefits for my labor progress? What are the risks to my baby? What are the risks to my labor? Things like that. So that would be your body rule. And so you do have control over that. And then you would ask, what are my options? And that's where like a really sick childbirth education, labor prep comes in. You would know some of your options, or at least you would be able to anticipate that there are other options because you've learned about that. Because childbirth educators, a lot of times, this is what I do in my class. I don't teach to the hospital that I work in or to the location that I'm at. I teach internationally. So it's like this could be some options that are presented to you, which is really helpful. And don't skip those parts. If you're taking an online course or you're taking a class in person and you skip the day you don't think you need, because going through other options that other facilities have empowers you and informs you about some potential choices. And if I know one labor nurse, and I know a lot of labor nurses, they are creative. And if your goal does not align with the rule or your feelings or your gut or your emotions or your, vibe doesn't align with a rule that you are being told has to happen, then coming up with something creative is actually what labor nurses are really great at getting creative. So if you play into that and you're like, hey, I know you're a sick nurse. I know you can help me get creative with this. I only know of one other option. Are there any others that we could try so I can avoid XYZ? Are you with me? Hey, Amber, you're catching alive with my first. Hey, Annie, I was told I had to leave my IV for 24 hours and I wasn't allowed to shower until the next day. I had to negotiate to get them to take the IV out. With my second, I was told I had to choose between delayed cord clamping and immediate skin to skin. Yeah, these are so common, Annie. And I have been a part of telling people these rules and trying to abide by these rules and even like telling people that this is what you have to do. I used to say, no, you're not allowed to eat anything in labor. I'm like, ooh, because when I started and where I work, it was like ice chips. And now it's clear liquids, but still I don't phrase it like that. That's why this crisscrosses with the words and language in labor and in birth, because you're not allowed to eat. Like, I'm not going to sew your mouth shut. So people are now expecting for me to say, oh, no, you're not allowed to eat in labor. Or they even say it. They put words into our mouths and they say to their family who brings them food, thanks for the milkshake, I'm not allowed to eat. Like, I didn't say you're not allowed to eat. I said your provider recommends and ordered a tray of clear liquids. That is what your provider recommends from, and if you want the evidence, there's some evidence that's older for NPO and more current evidence that doesn't support that anymore. I don't say that to everyone, but if they're asking questions, then, that's a very late time in the game to get that information, but you should still be able to get impartial evidence-based information, even if it doesn't align with the hospital policy, because a lot of times what is told to you is a system policy. It's not just that nurse or that provider. Now, that's not true for everything, but let's err on the side of, everyone's good to the core and wants what you want. They just don't know what you want until you tell them. And so give them a chance to be flexible and be like, that's not going to work, instead of just accepting that it's a rule for your body, because there aren't rules for your body. There's only facility rules. So if you think it's a rule for your body, then make sure you understand completely that it's a decision that then you're making, right? I know it's so much pressure, so much stuff. It's tricky, but in order to come out on top, stronger than ever, move into parenthood, being a badass that you are, getting through and having an amazing childbirth experience, feeling like you are in control the whole time, making choices for you and your baby and your body, you now have the ability to teach your child how to do that. They can imitate you. You've practiced this. This is in you to do. Then it is heavy and it's a lot of choices and it's a lot to think about. It's a lot of decisions, but I think it's like 90% prenatal. So if you're not in labor yet, then you're good to go. You're good to go. You can do this. You can get this information. You can ask these questions. You can practice communication. But it's a lot at one time. So I know it's a heavy one, but it's important. And if you're getting the feels or you're getting the faces going on, then it's meaningful to you. It means something. You don't want people telling you what to do. You don't want people telling you how to do things. You've been in control of your body for your whole life. Like, why would you give that up? You don't need to give that up. Just the language, the culture, our habits, our history tells us that we should. No, it's crazy. It's old school. We don't need to do that. We're business owners. We're professionals. We're adults. We can make these decisions. It's just knowing, okay, is this a facility? And you can have that discussion. Is this a facility rule, or is this something that is trying to be a rule for my body that now I need to decide about? You bring support people with you. Okay, you guys prepare together. So you guys know what you're up against together. Not necessarily up against, but a lot of decisions can be overwhelming. So that's kind of what you're up against. You might be up against a few decisions. Consequences to rules or policies. Those are easy to figure out because, they'll say we have to call the police, or we have to call CPS, or we have to like legal action. Those are facility, or we have to forbid whatever. Those are kind of facility policies. And if you need a second opinion, there's always other providers. There's always other nurses to ask. So just be like, hey, can I like talk to your charge nurse? Like, I'm getting it, but I'm not getting it. Can someone tell me in a different way? It's one way to do it. Are there any other rule? Oh, IV for an epidural. Oh, ho, 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 ho. IV for an epidural is a rule. Is it facility or body? Facility or body? I considered it. Now, I'm not like, I don't know everything. I considered a facility rule. It is for your body, but it is a trade-off for care that they are providing. Right? So in order for them to feel like they are giving you safe care, as in not causing you harm knowingly. So if they meaning like your team, your providers, your doctor, your anesthesiologist places an epidural without you having an IV, even if that is what you choose and you say, I want an epidural, I don't want an IV, then they can say, I ethically or can't do it because I know it will harm you. So that's a facility thing. You'll be hard pressed to find anyone to do an epidural without an IV, PS. But that is something that you would, you would discuss that in a childbirth class, because I could answer that for you and be like, yeah, that's probably non-negotiable. But then you can discuss it with your provider. And if it's non-negotiable in every facility that you have access to, then you kind of know your answer and you know the trade-off and how you're going to make that decision. Okay? Does that make sense? Tell me your questions down below if this helps. If you have any feels, if you made a face, give me a like, share with your friends, share with your pregnant friends. And I post videos every Wednesday. I will see you next week. There's one here. I forget which side it's on, but if you're on YouTube, there's one here in the corner you do not want to miss.